Dr. Bradshaw with Wilmington Functional Medicine, and today we're going to go over instructions on how to properly run a Doctors Data Comprehensive Stool Analysis test. It's a mouthful. So let's just start with, you should have a box, blue box, white box that you've been given by our staff. Let's just make sure that this is the correct test. So it should say right here on the end of the box, Comprehensive Stool Analysis, CSA. If that is indeed written on your box, we're good. If not, call our office. Let's make sure we get you either the right instructional video or the right test. Okay. Our staff is great, but things happen. So just check it first. Let's open up our box. What do we got? We got some goodies in here. So flip that tongue out, get the lid to open up. There we go. We're going to go through the contents, okay? First thing on top, you'll get what's called a test requisition form. All right? This has already been kind of taken care of for you except for this orange area. It's highlighted. Might be yellow. Should be highlighted. It's this section right here on the front side. There is a back side. It's been X'd out. Don't worry about it. It's just this side right here. Fill it out. It's your patient information. Easy to do. Okay? We're going to put that aside. Instruction manual. We'll go through that in a moment. Ice pack. Our staff should have already told you the very first thing you do upon coming home with this is to take this ice pack out and put it in your freezer. So if you have not done that already, do so now. Go put it in your freezer. You're going to need this frozen soon enough. Okay? Next thing, you're going to have a little French fry looking tray with a couple of baggies in it. There's one vial in each of these baggies. Okay? There'll be a little, we'll go over them each in just a second. And then last but not least, at the bottom, rubber banded together will be the shipment bag that you're going to use to ship this off via FedEx, and there will be a label to use. We'll talk about that at the end when we're ready to ship. So, you've already got that requisition form filled out like we talked about. You got your freezer, your ice pack, in the freezer. Let's talk about kind of the instructions on how this should work. First and foremost. By the way, keep this original packaging. Don't throw this away. This is important. You're going to put stuff back into here and ship it all in that bag. So put that aside. Let's go through the instruction manual. If you open it up, this kind of has the contents we just went over. But we're going to talk about some things that you must do or avoid prior to you doing this stool test. And this, by the way, is a stool test, as the name may have suggested. So we're going to be collecting poop today. We're going to be fun. It'll be fun. So let's talk about 2 weeks before the test, what you have to avoid. Antibiotics, antiparasitics, antifungals, probiotics, PPIs, and bismuth. So antibiotics, straightforward. If you're taking an anti-parasite medication, antifungal. If you're taking probiotic supplements, which are generally good for your gut, got to get off of those too. This is a full 2 weeks before your test, all right? 14 days. Proton pump inhibitors, the PPIs, those are like what you use to inhibit the acid in your stomach. Oftentimes people with heartburn have them. You got to get off of them for 2 weeks. So make sure you get off all of that before you do your test, all right? And then 2 days before your test, aspirin or other type of ibuprofen. No digestive enzymes or betaine hydrochloride, those things that help you digest your food. None of those. 3, no laxatives like mineral oil or castor oil are also a form of laxative. Don't do those. No enemas, no activated charcoal or bentonite clay, anything like that. Done. Can't do that. And no suppositories. So 2 days before your test, none of those things as well. And they're all listed here in the middle column of this booklet. Also, if you are having bleeding from menstruation, so obviously female, can't do the test. You're going to have to wait till you're done bleeding before you can do the stool test, as well as if you have hemorrhoids. So if you have active bleeding hemorrhoids, you cannot do this test. Those need to heal up first. You need to have blood-free stools, okay? If you've had a colonoscopy or barium enema, you got to wait a full month before you do this test. So if those have been done recently, you have to hold off. Wait till a full 28 days until you're done and past that, and then we can do this test. Okay? You want to try to avoid contaminating your stool with urine or water. So let's just talk about how that's actually going to work. All right, so we're going to set that instruction booklet aside for a second. We're going to get our little French fry tray, which is comical to say the least. I can tell you from personal experience, having done one of these tests, this sometimes will not collect all of the poop. So make sure you're near the toilet. Make sure you're near maybe some towels to help clean up when you're done. But you're expected to poop into this tray. Okay. Inside one of these bags, this one right here, you're gonna find a glove. I recommend you use it. Let's get all the contents of this bag out. There's a vial with a yellow cap, a little red fluid in there, but the yellow cap's important. A wipe, how nice of them. A wipe in case things get messy. Baggie for this, don't throw that away. The specimen will go back in there. You'll put your glove on, obviously. Use that glove to keep your hands clean. In the other specimen bag, similarly, you've got a vial, but it's got a white cap. So that one with another wipe. And that's it. There's no glove in that one. So you got one glove. They're not willing to give you two. If you want to use a second glove of your own at home, feel free. That may not be a bad idea. So you're going to poop into the tray. Okay? Once that's done, then you're going to take the white vial. You're going to take this one, and you're going to open it up. You're going to unscrew the cap, and inside you're going to see there's an attached spoon. It actually looks like a spork. I'm not sure how well you can see that. Got a little teeth there at the end, but basically it's going to help you go and get scooped up poop. You're going to go into one end, you're going to scoop it up, you're going to put it into the vial. Okay? Now, you can see there's a red line right here on your vial. Do not go above that line with the poop. It's too much. If you overfill it, you'll screw it up. Okay? So there's a little bit of fluid in the bottom of here, but you're pretty much going to need to put enough poop to fill the bottom of this thing up to that red line. So, decent amount of poop. You'll probably spoon it a little bit. Don't spoon from just one spot in the poop. You want to move it around. So I usually say, start on one end, scoop in the vial. Go to the middle, scoop in the vial. Go to the other end, scoop in the vial. If you don't have enough to the red line, go back to the first end, scoop again, middle, end, until you fill that poop from the bottom up to that red line. Okay? Once you're done, put it back on there, screw that cap on tight. Do not leave it loose. It will leak. Your test will be null and void. I'll have to send it back to you and do it again. All right? It's going to take you longer to get your results, longer to get better. So let's make sure you do this correctly. Get that cap on tight. You are then going to see there are a white sticker here with lines. You're going to write your name. Make sure we get this right. You're going to write your name and the date of collection and your date of birth on there. Okay? And you want to make sure that you do that for this vial and for the other vial as well. So once you've got that vial, this vial is going to be frozen. My staff should have told you this when you first got this test at our office, but in case they didn't, let's be clear now. This one with the white cap is going to be frozen. This one with the yellow cap is going to go in the refrigerator. So you're going to take this, you've already got your ice pack frozen in the freezer, just put it in on the shelf, lay that right on top of it in the freezer, and just let that sit. All right? We're going to refrigerate it over a full day, make sure it's nice and frozen before we do anything with it, okay? Probably best to put it in the specimen bag so it's already done. You don't forget to put it in because they're not going to be happy if you put this just in the box floating around. It needs to be in that bag. Go ahead and just do that first, then put the ice pack on top of there in the freezer, okay? Now that's in the freezer. We still have our poop. We're going to take our other vial. We're going to open it up. By the way, the red fluid in here is poisonous. So be careful, okay? When you're opening this, don't get silly with it. Don't open it around kids or animals. You're going to crack this. And again, you're going to have a spork at the end of that. And just like we did with the other one, you're going to scoop on one end, add it in. Now, this one has a lot more fluid in it than the other one did. So you are actually going to need just a little bit of poop. But But I still want you to go into one end, scoop, put it in. Probably won't be enough. Go to the middle, scoop, put it in. By that time, you should be getting pretty close to that fill line. That red fill line is right there. You're only going to need to get, what, that much of poop? That's not much. If you need to go a little more, go to the other end, scoop, fill it up, but do not overfill. Okay? Overfill will screw this up. Do not do that. Only go to the red line. Get it right up to the red line and stop. Put the yellow cap back on, like we talked about, nice and tight. Make sure it's on tight. Take your information, name, what do we say, date of birth, and the date of the collection, the date of the poop, okay? Name, date of birth, date of collection. Write that on there. Don't forget, because that will definitely screw this up too. This one will not go in the freezer. It's going to go in the fridge, okay? So put it in the fridge overnight. Oh yeah, sorry. Put it in your bag too. We don't want to forget that as well. Put it in your bag, Ziploc baggie, fridge. We're good. Poop, toilet, trash. Glove, wipes, trash. Okay? All that stuff. Next day, we're going to want to ship it off. Now, because this is an overnight shipment, we don't want to ship it off on a Saturday because the lab's not open on Sunday. But you can ship it off Monday through Friday, no problem. If it's a Friday, they'll get it on Saturday. The lab is open on Saturday. Okay? So you don't have to worry about that. But Saturday, if you get your sample, you're going to need to wait till Monday to ship it off. Okay? And don't wait too long. We don't want to get these samples sitting in your fridge or in your freezer for days on end. When we get these results off to the lab, get the results done back to us so we can go over them with you sooner than later. Okay? Besides, I don't think your family or your roommates or whatever want to see your poop in the freezer at all. At least I wouldn't. So, we're going to take the freezer pack and the white cap out. You're going to put it right into your box. Put that freezer bag right on top. Boom. Take your yellow cap bag out of the fridge. Put it into the bag. Boom. You're going to take your requisition form. Put it in here. Boom. Now, they don't say this, but I recommend, because now that we got all this in here, there's actually a lot of space, it's just kind of an empty part of the box. I would recommend putting some paper towels, something to kind of make this fit a little better, so it's not juggling around and jostling around. That's just me. I just think it's a good idea to do that. So, a few paper towels, fill it up so it's nice and full. Close it up. The top in. Get that little tongue in there. I also recommend, it fits fairly well, but I feel like that can kind of slide out. Just a little bit of pressure, it can just come out. So I recommend you put a piece of tape over that. There's no way that bad boy's opening. You're going to take this, you're going to put it into your FedEx bag. All right, and open up one end, slide this in. Then you're going to take your liner, you're going to peel it, it's going to be sticky, close it, seal it. You will see here, there's an orange label, category B. This means this is a biological substance. FedEx wants to take care of this a certain way. You are not going to drop this off at a FedEx drop box, okay? So you can see there's a little bullseye right here in the front, a square. You're going to take your label, you can see it here. You're going to take and write your name, your return address, right here where it says from. Okay, it couldn't hurt to write your phone number over here on the right here as well. Just in case something happens, they can call you. Don't mess with anything below that line. This barcode and all this right here, leave that alone. You're just going to write your name, return address, and your phone number right here. Okay? Before you put the sticker on, I recommend you take this little side. You can kind of see it folded down right there. You're going to peel that off. That you're going to take off and put on the front of your instruction manual. Just kind of stick it there, just in case. In case you need to track that package, you've got this with the tracking information on there. Okay? It's the only thing we're going to keep. It's the only thing you're going to have left after we do all this is this with your tracking number on it. Then you're going to peel your major big sticker right there. You're going to peel that off. And you're going to put that onto the bullseye. Boom. Right there. You're ready to go. Almost. On the back here, it's going to say, schedule a pickup. You must schedule a pickup for this type of substance, okay? Due to the makeup of it, you are not allowed to drop this off at just any old FedEx. It's not going to work. So you're going to call FedEx. There's a number right here, 1-800 number. At the greeting, you're going to say schedule a pickup. When prompted, you're going to say schedule a pickup using a label or stamp. Reply yes when asked if the word stamp is written on the waybill. And again, all these instructions are right here, so you can just read them. They will then ask you for your address information because they're going to come pick it up from your, whatever you are, work, home, whatever. Do not use a drop box. I just want to be very clear. That will screw this up, okay? But this is all paid for. You don't have to include any payment or anything. It's all done. Just make sure that label gets on there just like that. They'll come pick it up, and you are done. Stool test is complete. Results should be back to us within 2 to 3 weeks, a month at the latest, but should be sooner than later. And then once you're done with that, we'll be able to go over them with you, determine what the heck is going on, and get you a game plan. All right, so hope that was fun, and we look forward to helping you.